monitoring camera, we've got the capability of airdropping procedures to patients. Now, their main complaint was that they experienced severe itchiness and irritation in their ears. Now, the patient has got very narrow ear canals, and they suffer from a condition called otitis externa. Otitis externa is an umbrella term for an infection and or inflammation of the outer ear canal and the outermost membrane of the eardrum. So the eardrum has three membranes. You've got the inner membrane, which is a mucosa membrane, which is exposed in the middle ear. You've got a middle membrane, which is made up of fibrous tissue, connective tissue, and then you've got the outermost layer, which is a layer of skin, the same skin that lines the ear canal. So you get different grades, different levels of otitis externa. I've kind of almost simplified them. You can get, generally it's termed superficial otitis externa. That's when it's just the surface of the ear canal that's got a bit of dry skin, eczema, psoriasis, just like it in this patient. And theirs is more lateral, so you can see I've taken that dry piece of hard wax out of the ear using suction. You can get deep otitis externa. Deep otitis externa is when you get a bit of inflammation, a bit of swelling in the ear canal. Then you can get more severe cases of otitis externa. It's known as necrotizing or malignant otitis externa. It's more common amongst the elderly, those who are immunocompromised, diabetic. And that's when, because the immune system's not as strong and as effective, the ear infection of the ear canal can start spreading rapidly across the almost to their brain. In some occasions, it can cause a brain abscess, meningitis. It can cause Bell's palsy, so damage to the facial nerve, which is on the promontory of the organ of hearing. So the cochlea in the inner ear, you've got the facial nerve. So that's exposed in the middle ear as well. And the reason for that is, for example, diabetics, they've got damage to the blood vessels, so there's not a constant or rich supply of blood, which helps to fight infection. And obviously, if you're immunocompromised, you're more susceptible to infection. So 3 types. There's no official grading, I don't believe, for this, but it's kind of what I've termed myself. Superficial, so it's just surface dead skin, psoriasis, eczema, like this patient has. Then you get deep otitis externa, where it's more swollen and inflammation, and then you can get quite severe otitis externa, so necrotizing, malignant. I kind of learnt that from, believe it or not, I used to have a German Shepherd, so I'm trying to remember what age I was in my teenage years. Her name was Gally, and German Shepherds, you may not be aware, but they suffer from German Shepherd pyoderma, so it's a skin condition, and you constantly having to go to the vets. Used to give us corticosteroid cream, and the vet kind of explained to me there's different levels of German Shepherd pyoderma. It's superficial. For that, we were trying to use more natural remedies because you want to avoid steroids, prolonged use of steroids. We used to use tea tree cream, for example. But if it was deep German Shepherd pyoderma, so there's inflammation, swelling there, they used to give steroids. So that's kind of where I've developed my own kind of grading system for otitis externa in the human ear. So what I'm trying to do now for this patient is just peel as much dead skin off as I can. We're never going to get all this dead skin off. It's just near on impossible. So we're just trying our best. And to peel this dead skin, we are having to make contact with the canal wall. And laterally, it's on the cartilaginous portion of the ear canal. And we can apply a bit of pressure because that's cartilage. It's semi-sensitive. Doesn't mean that it's non-sensitive. If you're quite aggressive in the outer cartilaginous portion, it can still cause a bit of injury and trauma. It can be unpleasant for the patient. But if we're on the inner 2/3 of the ear canal, the bony part, and we start bumping into the canal wall, it can be really, really uncomfortable for the patient. Now this skin is really thick, it's strongly adhered, so I'm just slowly but surely peeling it away. So we're just at the base of the ear canal here and anteriorly. You can see we're just trying to bring this skin together and then peel it. I'm going to compare it to when you've got some sticky tape, sellotape on an envelope or a piece of paper or some cardboard, and you're trying to remove this sticky tape by gently peeling it without damaging the envelope or the piece of paper or the cardboard outer layer. And that's what we're doing. Obviously in the ear, patients are awake, it's a lot more sensitive, you can be really uncomfortable. In terms of patient, we've just advised the patient, we've given them some over-the-counter treatment for the moment, suggested some acetic acid spray. So the ear should be slightly acidic in pH. I think it's about 5.4. Don't quote me on that, but I think it is. And the acidity of the ear is very useful. It inhibits certain bacterial growth, it repels insects, or tries to repel insects. And earwax itself is naturally acidic. However, when you develop otitis externa, studies have shown when they've done a pH swab, is that the acidity from the ear turns from an acidic pH more to an alkaline, just above 7, around 7.4 to 8. So these acetic acid sprays you can get over the counter are designed to re-acidify the ear. And by re-acidifying the ear, the acid hopefully would inhibit the bacterial growth that's causing this otitis externa, or obviously if it's fungal, otomycosis. I believe, I was watching an ENT surgeon who did a YouTube video about acetic acid, and they made reference to, and I give them credit of course, that a lot of Olympic swimmers, for example, and again, don't quote me on this, this is what I've heard from a third party, a lot of Olympic swimmers, they actually use acetic acid before and after swimming in the water, so because the water can wash away the acidity. So finish with the left ear, just in the right ear, again, a really hard, dry piece of wax, dead skin. Suction wasn't going to remove that, so I've gently used an ear hook. I've prized it off the posterior canal wall, so I've loosened it. I've then embedded the tip of the hook within the core of the wax, and I'm just rotating the hook in a different direction, getting quite deep there now. Slowly but surely extracting it. You just see how dark that is, so that's been there for a while, it's oxidized. So again, more medially, the ear canal is really healthy. So there's a lovely view of the eardrum, which is nice and healthy. The canal wall, medially, on the bony part, looks pretty good. It's just more laterally here. You can see all this dead skin, and it's really, really frustrating for the patient's itchiness. It's something that they suffer from chronically. It can really get them down. Now, with the acetic acid spray, I think in terms of guidance of use, you can't overuse it. So the initial course is 7 days. Thereafter, I've advised the patient to avoid watering the ear. Again, if you've been watching my video, you know I'm really anti-watering the ear. Water can cause all hosts of problems. In fact, I had an email from a clinical ear care specialist in the UK, just I think it was on Friday, and unfortunately it went to my junk, so I only read it yesterday. I replied back to them immediately. They perform earwax removal, they use ear irrigation, and they were really concerned by the number of people that are coming back with ear infections, and they're just asking for tips from me. Obviously the main tip was to avoid water, but currently that's all they're trained in. So the best advice I could give was, obviously they're following all the precautions when they're performing ear irrigation. So the tank itself, they're sterilising that every day. Is a special tablet. So when you have your ears irrigated at the doctors or nurses in primary care, the irrigation system, just to kill any bacteria in the tank, they use a special sterilising tablet. So they're doing that. They're doing everything else fine. The temperature, the water's, it's what it should be. If it's too cool, it can get the cryonic effect as well. So they're doing everything they can. However, patients are still coming out with chronic ear infections. Things on top, and they also use a bit of dry mopping. So I know in America, dry mopping is used a lot. They give it a cotton wool, and you attach it to the end of a Jobson horn or St. Bart's ear hook. There's a serrated tip there, and the cotton wool, kind of, you wrap it around the serrated tip, and then you then go into the end, spin it. I don't like doing that because I think, well, you're grazing the ear canal deeper in the ear as well, so making it more susceptible to infection in some ways. And you can always get these fibres that come loose in the ear. But they're doing that also with the majority of their patients. So the only additional advice I gave was to use a hairdryer. Now, guys, do this very, again, apply some common sense as well. You don't want to put the hairdryer right next to your ear, full pelt. You're going to perforate your eardrum. Just at a distance, trying to do it at quarter. So on my hairdryer, I've got an eco mode, so it's kind of room temperature. And little brief moments, 4 or 5 seconds, and you stop. But you're always doing it from a distance and lowest setting. So just almost ventilating the ear as opposed to drying it with a hairdryer, just ventilating it. And also just advice on acetic acid as well. So ear calm, which is we call it ear calming over the counter in the UK. That will help re-acidify the ear because water can wash away some of the natural acids in the ear. So you're kind of re-acidifying it post getting water in. But the best advice I could give to that clinical ear care specialist was, well, get trained in using mechanical removal, so with hooks and scoots and forceps, and also microsuction. So you can see you've got this is a bit of skin here, the base of the ear canal, just using a fine end gauge. There's been a bit of controversy, I think, with my terminology. Apologies, guys. Gorger gauge. I'm using a fine tip sucker. I'll just call it from now on, I think, if I can remember. So just gently lifting this off the base of the ear canal. Going to be really, really gentle. I don't want to touch the canal wall. That game of operation, the patient will start buzzing and, well, not be very happy if I do, because it will be very uncomfortable for them. So again, we're not going to be able to get every little aspect out. It's just not possible, guys. Just going to do as much as we can as safely as possible. And we're giving some patients some ear care tips. They are a keen swimmer as well, so we've recommended obviously really discuss water precautions. So some custom-made swim molds or over-the-counter ones as well, but custom ones are better. However, they're a bit more expensive, so they're going to try the ones at the counter and then revert back if need be. The eardrum's really healthy, both sides, got a lovely light reflex. So it's a real finesse procedure, these ones. So just on the lateral canal, well, this is the cartilaginous portion, so we can put a bit of pressure here. When you've got a patient with a very narrow twisty ear like this, we just have to really stretch the ear open. So if we can straighten that first bend to make it in line with the second bend, it turns the ear canal into a straight cylindrical tube. Otherwise, the ear canal is like an S bend. And we've got two instruments in the ear, or even if it's one instrument, if you've got the sucker, that's a straight instrument. It can make it difficult to navigate the bends of the ear. So by straightening the ear, you can use straight instruments. You can make the procedure much easier, basically, for yourself. So we're having to do that with this patient on both sides. The ear canal is very narrow, very bendy as well. Alright, guys, I'm going to finish the narration there. It's just me peeling off the skin. I hope you're all keeping well and safe. And stay tuned for some more videos. Take care. Bye.